A lot of people have been asking me to define the difference between a psychologist and a psychiatrist. And I'll try to do so today, briefly. But in the process, I'll try to make you learn something else that was never in your mind. That is the natural progression of mental illness. Now, a psychiatrist is a medical practitioner holding a degree in medicine and surgery with further training in Master of Medicine in Psychiatry. A psychologist, on the other hand, is someone who holds a bachelor's degree in either clinical psychology, medical psychology, or counseling psychology. There are some difference between the three types, but I'll not dwell so much into it. But also, if you have a primary degree in medical sciences, like maybe MBCHB, clinical medicine, nursing, etc., you can do psychology and become a psychologist via a master's degree. So you can join a master's degree in clinical psychology or a master's degree in medical psychology. Psychiatry is still left exclusively to holders of Bachelor of Medicine and Bachelor of Surgery, and only at the master's level. So you cannot become a psychiatrist at the bachelor's level. So the psychiatrist, being a medical doctor, will treat your mental illness medically. So meaning they'll assess you, make a diagnosis, determine which treatments you need to control the symptoms, and control the symptoms that way. They will talk to you at least briefly to make you understand your disease and also to give you a few tips here and there on how to manage it. The psychiatrist will also try to tie in everything together medically. So they'll send you for testing to discover if you have other issues in your body that may be changing your behavior. And sometimes just handling those physical aspects of your behavior modifying diseases will sort your mental health issues even without any mental health therapeutics. But if you want someone who will spend a lot of time talking to you, trying to adjust your behavior and giving you coping strategies and behavior modification techniques, then that is where the psychologist comes in. So the psychologists are talk therapists. So they talk to you, they try to understand your disease from the emotional and the psychological point of view and try to give you solutions based on what they discover. And they try to give you behavior modification techniques so that you don't become worse with the disease. And also they try to give you coping strategies to handle the disease better, and also give you interpersonal skills so that you are able to relate with people better even despite having the disease. I want to talk about the natural progression of mental illness. So mental illness usually has 4 stages. That is the premorbid stage, or what we call the asymptomatic stage, the prodromal stage, or what we call the silent symptoms stage, the symptomatic stage, or what we call the acute phase of mental illness, and then finally the residual stage. Looking at this natural progression of disease, the asymptomatic stage or the premorbid stage, you actually don't have any symptoms. So basically, you are just operating normally. And that means that every one of us, including me and you, could be at that stage without knowing. But what is most important in the stage is that if you are predisposed to mental illness, the predisposition is there. It is just waiting for the right trigger for the mental illness to come. So maybe the trigger could come in form of drug use, or in form of a severe stressful event in life like losing a loved one, and then it tips you to mental illness. At this stage, the psychologist is very important, because at this stage is when you can be talking to your psychologist to try to tell you what to look out for so that to avoid getting triggered into mental illness. So let's go to the prodromal stage, or the prodrome. The prodrome simply means that the disease is on the verge of happening, but it has not yet happened. So you are no longer asymptomatic and you're starting to have minor symptoms here and there. So these symptoms could be difficult to notice, but with a keen eye, someone could notice, and they usually present in form of minor behavior changes. So maybe you used to be the biggest fan of football, but now you're no longer even interested in it. Another way that this stage could present is decline in function. So meaning, maybe you used to be very brilliant in school, but now you are dropping down. Slight changes in behavior here and there could show people that you are on the verge of cracking. And at this stage, also the psychologist is very important. They could manage to teach you coping skills to cope with the stressors that are starting to crack you in order to prevent that mental health episode from breaking through and affecting you. Now we get to a place where the psychiatrists play a big role, and that is when you have an acute mental health crisis or an acute mental health episode. So this is the disease stage or the symptomatic stage of mental illness, and you get an acute mental health episode. So maybe a psychotic break whereby you are seeing things, hearing voices, and this is where the archetypal mentally ill person is described. Also, another thing is maybe you are suffering a manic episode and you have broken all glasses in your house. So at this stage, mental illness will affect how you function and how you relate to people, so much so that they cannot stay with you at home. So they only have one option, to take you to the hospital. And this is where you will meet a psychiatrist. And a psychiatrist, being a clinician, will look at you, assess you, use the DSM criteria to diagnose your mental illness, use lab tests and imaging tests to rule out physical illness. If physical illness is found, liaise with doctors who treat the various physical illness to treat you. If physical illness is not found, then a confirmation of mental illness is made and treatment for mental illness with psychotropics is administered to stabilize you from that state of acute mental health crisis, where psychotherapeutic techniques will not help you, into a state whereby you are calm and the psychologist can come in and proceed. And when the patient is stable enough, also we will do patient psychoeducation. So the psychologist will do something called family psychoeducation. The family needs to understand that this is a mental health crisis and it is not simply a person acting out or behaving stubbornly. And finally, we are reaching the end of it. So this is the chronic stage of the disease, or the remission stage of the mental illness. So in this stage, the psychologist also is important in maintaining mental wellness. The psychiatrist is also important in making follow-up, and this is where you attend clinic. So at this stage, the patient is required to attend clinic regularly for follow-up so that they don't suffer another mental health crisis that was sorted in the stage before. The psychologist will continue with patient psychoeducation, which includes individual therapy sessions and also group therapy sessions with other patients with mental illness so that they may understand each other's perspectives. I think I have explained well the difference between a psychologist and a psychiatrist, but this is a brief description. I think for me to properly differentiate these two professions, then I need a very long video. Thank you.